just to get the certificate without the test.
This is another discussion. We can do that. This is at the gamble table tonight. And with the gamble, who win will get a negative test. Who lose.
I think the positive points are easy to
Okay, just before the lunch, we will move from inflammatory pancreatic diseases to the aplastic ones. The first session is the pancreatic solid tumors. I think to introduce my co-chair, Jonas Rosendahl, or you know him from Halle, Germany. My name is Tibor Gyökeres. I'm a clinician. I'm working in Budapest, and I have the largest gastro department in Hungary. So the first speaker will be Bálint Erőss. Bálint works for the Hungarian Pancreatic study for a long time, and now he works in Samoas University at the Center of Excellence for Pancreatic Diseases. Bálint, please.
Thank you for the kind words of introduction, and this is my pleasure to talk about what we have been doing for pancreatic cancer, what we are doing, and what we would like to do for pancreatic cancer within the Hungarian Pancreatic Study Group. So my talk will cover the past, the present, and the future, and it will focus, the last point of my talk will focus on the Pancreatic Cancer Registry. Let's talk about the beginning. A time of jubilee is always a time of reflection as well. So we started this journey 10 years ago, and I've been lucky to be part of this journey for the last 6 years. 10 years ago, we set out to cover all pancreatic diseases and develop the scientific activity and the clinical work as well in Hungary. And we decided to cover all diseases, and you will have seen by now that so many fields are covered really well, especially the inflammatory diseases of the pancreas, CF as well, you will see in the afternoon. And my task here today is to talk about what we do with pancreatic neoplasia. This has been a long journey and steep learning curve. And I've got a feeling it is getting steeper, luckily, these days. Out of the 155 publications in the field of pancreatology in the last 10 years, I've looked up our activity on pancreatic cancer, and there have been only 23, which is, you know, it's always a relative number. And you can see that the number of publications by the Hungarian Pancreatic Society, or the publications related to the Hungarian Pancreatic Society, has increased. Last year, 9 studies published in the field of pancreatic neoplasia. The humble beginnings. So in 2011, we set out to do some work around pancreatology, and we decided to start a pancreatic registry. And the first analysis came out in 2016. By one of our excellent colleagues, Gabor Lakatos, who then moved on with his career. And sadly, the Pancreatic Cancer Registry went into a sleep mode at that time. But by then, we were able to gather data of more than 350 patients from 14 centers across Hungary. And we really did the first large cohort analysis from Hungary on pancreatic cancer. This was followed up by a smaller cohort from the single center, but a more specific goal to assess the efficacy and safety of FOLFIRINOX therapy. As we increased our knowledge in the methodology of meta-analysis, we started to do some work around pancreatic cancer as well. And we are very happy to have Stefania Bunduk on the team from Bucharest, and we are very grateful to the Pancreatic Society of Romania to have her with us. And she has just 2 very recent publications on the prognostic role of cell-free DNA and exosomes in the pancreatic cancer in very distinguished papers. There was another very important paper in clinical translational gastroenterology, which is around stenting in pancreatic cancers as well. And there was a previous publication, again in association with the Romanian collaboratives on pancreatic associated genes and the risk of pancreatic cancer. So we have done some meta-analysis in pancreatic cancer, and we are doing meta-analysis in the field of pancreatic cancer. This is one of the ongoing projects which has got a slightly surprising preliminary result. This study looks at the time interval between the diagnosis and the initiation of treatment for pancreatic cancer. And if you look at the data here and the studies and the pooled analysis, what we found was slightly surprising that the timing of the initiation of treatment is not associated with the overall survival of cancer. However, we believe that this data has to be taken with criticism, because we believe that time from diagnosis to treatment is potentially an important factor in the outcomes of pancreatic cancer. This is very preliminary result, and I think Peter is seeing it first time, and some of the audience who's been involved in this study is seeing it first time as well. So we have to go through this data in details a little bit later. There's another ongoing and important meta-analysis on the use of needles in endoscopic ultrasound for the detection and specimen acquisition of solid pancreatic tumors. This is the network of the studies, what we identified through our systematic search, and what we found was slightly surprising. The smaller the needle, the more adequate the histological sample for assessment. This is again preliminary data which needs to be assessed later on. But we are doing meta-analysis, we have done, and we are doing meta-analysis in the field of pancreatic cancer. Through the recognition of our work in pancreatology and being recognized as an important stakeholder in pancreatology by the international community, we have been privileged to be invited on very important guidelines on pancreatic cystic neoplasms, and another guideline published in pancreatology, which is a joint guideline by many associations on pancreatic cancer again. It is important to note that Hungarian Pancreatic Society does have a leading role in implementing up-to-date pancreatology in Hungary, and therefore I must emphasize that creation and pulling the first version of and publishing the first version of the pancreatic cancer guidelines in Hungarian made possible that the wider Hungarian Pancreatology Society does have an access to the most up-to-date guidelines in Hungarian. And I have to note that as part of doing some meta-analytical work, being part of guidelines, we have been making efforts to launch studies in pancreatic cancer as well. And this is one of the published guidelines led by the Szeged group, namely László Czakó and his study group on newly diagnosed, which focuses on patients with newly diagnosed diabetes and their risk and natural history of pancreatic cancer, which is a study which is being launched. So this is a long list which you can't even read, because this is 14 studies through our contribution to international studies by virtue of providing samples from our large cohort of patients. And we are very happy to have here Daniele Campa and Federico Canzian, who will talk about later the Pandora consortium. And because most of these studies are published as part of the joint effort of the members of the consortium in the Pandora study group. So this is what we have been doing. This is where we are. And through the last 10 years and the work in the last 10 years, we have identified a few stumbling blocks which we have to overcome if we want to see a breakthrough in pancreatic cancer research in Hungary. And if you just not want to follow but set the trends, we need three things. We need a network. We need a network of national, and of course we have to join the international network of pancreatic cancer research society. But we need a network in which the stakeholders and the participants share the aim of scientific research. Of course, all participating centers. I think this is work in progress since 2011, and looking at the audience here, I think this has been a successful effort, but this is what needs time, effort, and money as well. What probably will help us to be more to have more results and to be more successful in producing primary data and primary data analysis in pancreatic cancer is two things. We needed a multidisciplinary team in a national center concerting the efforts of pancreatic cancer research in Hungary. And in October, we have been lucky enough to launch a brand new unit at the University of Semmelweis dedicated to the pancreatic diseases. And this is a unit where not only pancreatic inflammation, but also pancreatic cancer is looked after by our team, doing not just investigation and palliative care of pancreatic cancers, but active oncological treatment, which I think is very important. And we're very happy to have a very strong multidisciplinary team which meets twice a week. Now let me talk about the Pancreatic Cancer Registry, which I introduced previously in my talk. This has gone into a sleep mode in 2016-17 when we did not have enough focus on it with 350 patients already in the registry. So this registry, throughout our extensive experience and in recent years has been re-updated and relaunched. And we used our important principles in relaunching this cancer registry. And you will hear a little more about the role of this registry and the MDT team around it by Tamás Hussein tomorrow. So the important principles which we follow, this is a registry which consecutively enroll patients. The data is prospectively collected. So all patients enrolled in the registry has to consent to data collection and also to biobank sample collection as well. And from the point of entry, the data is prospectively collected. So it's not retrospective data collection from poor quality records, hospital records, and it happens on an electronic platform which is web-based. We collect extensive data, so not just simple data like gender and age and tumor staging, but extensive data, including comorbidities, for example, and drug history, just to mention a few. We built in systems into this data collection so that we reduce the risk of missing data, which is always a limiting factor when you come down to analysis of clinical registries. We have got a robust and very rigorous data quality monitoring system at 4 levels at the point of entry, and by 3 additional professionals understanding the data and the importance of the correctness of data. What I already mentioned is that we collect biobank samples upon consent of the patients for purposes, for studies which are not there yet, because maybe there are some methods which will be used in the near future for which we need these samples. And this data set does not just capture the pancreatic cancer patient at a single point, but this follows the patient, which gives us the opportunity to better understand the disease course. To be absolutely rigorous and robust about our registry, we have got an SOP, a standard operating procedure, written down across many pages, which kind of regulates how we deal with this data and how we approach these patients. Patient with a pancreatic solid mass with a suspicion of pancreatic malignancy appears on our radar, and if it's proven this neoplasia, if this mass proves to be a cancer, then the patient gets into the system and will be consented to participate in the registry, and this registry captures the data. Now, this data collection is designed by all stakeholders in the multidisciplinary team around the pancreatic cancer, like interventional radiologists, surgeons, oncologists have contributed to this data collection, etc. And what I already mentioned, that we capture the data at the point of entry and we follow up these patients in a structured manner, pre-set times. So this is our pancreatic cancer registry, which we believe will be able to prove the analysis and the study of biomarkers and the disease scores, and contribute to even more international studies with samples. And this is a registry which helps us to monitor the quality of care at our unit. And with that, I'd like to close my talk and thank you for your attention. And what I would like to say now is that I think I've made the point that we have done the off-season training and the hard work. The race is beginning now, and we would like to measure the true impact of our research in pancreatic cancer, not just by scientometrics, but also in saved lives and better quality of the patients. And whoever is interested to join this effort is welcome, and please find us to work together towards a better understanding and better care of pancreatic cancer patients. Thank you very much.
Thank you for the brief overview and really admirable results. Any comments? Questions? Please.
Quick comment. I think just following up on Peter being self-critical, looking in the mirror. I think the study group has been traditionally very weak on the cancer front, both clinically and at the basic level. And this is a great thing that that we initiate this effort. But I think at the basic side, we also have to make an effort, because there's no way to do translational science and you're biobanking for what?
Yeah,
because who's going to study that? So I think we have to do better and in parallel start up, the translational and the basic side for cancer research too.
It's always good to start from zero, because we have
that.
But it looks promising. Did you do any efforts to harmonize your databases with other ongoing projects that are available throughout Europe? So just this is really important.
Yes, we should.
Yeah, because then it's really usable in all consortia. And I guess a lot of consortia will ask you for data and tissue and DNA and whatever.
So what we are aiming to collect high quality, top quality data attached to the biobank. What we have seen in acute pancreatitis is that the data quality and the extent of the data, what we have in the acute pancreatitis cohort is quite unique, and that's what we would like to reproduce in pancreatic cancer.
Very good. Thank you very much.